Welcome back. Well, today I am joined by Ildiko Vitez, who is here on behalf of MemorialCare Saddleback Medical Center. Well, welcome. Very nice to have you on.
Hi, Lisa. Thank you so much for having me. I'm very excited to be here today.
You're welcome, and I'm really excited to learn more about a brand new division within MemorialCare, and we're here to have you tell us all about it. But before we do that, let's learn a little bit about yourself. Tell me about what you've been doing for the last 14 years for MemorialCare and just how you got into it.
Yeah. Thank you so much. I have been a nurse for 19 years, but 14 years in MemorialCare. And my background is critical care and also 7 years of recovery room care, as well as the last 8 in care management. There's a special emphasis on orthopedic patient population. I also am a double certified registered nurse, certified in critical care as well as care management.
Okay.
And I'm currently enrolled at California State University Fullerton's Masters in Nursing Leadership Program.
Oh, wow. So you're busy. That's a lot to take on. Now, when you talk about critical care, is this patients who are of the utmost need? Is it usually after surgery, before surgery, during? What would that cover?
So critical care, when I used to work at critical care, it was an inpatient care of patients who are critically ill. However, right now in my role as a spine nurse navigator, I have an opportunity to see patients before, during their hospital stay, and after surgery.
Okay.
So as a nurse navigator, spine nurse navigator, I guide patients before patients, their coaches, and their families before surgery. Via phone calls, via education. We have a bi-weekly education, preoperative surgical education program that we have provide for patients, and then I follow up with them during their surgical stay at Saddleback and coordinate care with their physicians, nurses, with occupational therapists and physical therapists.
So you're just walking them through the entire process. So that's great. And this is primarily people who, well, this particular division, which is fairly new, is the Joint and Spine Center. So this is a fairly new situation for MemorialCare. How long has it been around?
So we have, in my role as a spine surgical navigator, I started to work in this role in November 2022.
Okay.
Our role is to guide the patient every step of the way throughout their process and after discharge by follow-up phone calls and connecting them with resources they might need.
Okay. So obviously it's, so if somebody has surgery on their back or neck, this is primarily who we're dealing with, correct?
Correct.
Okay.
The spine surgical population is what the Spine Health Center is for.
Okay, perfect. Now, what you're saying here is that you are the navigator and you walk people through the entire process, like from the beginning to end. Now, why did MemorialCare decide to have this type of program?
The number one reason is because it is so beneficial for patients.
Okay.
The benefits for the patients is it's my great enjoyment always in this program to see patients after our program be ready for their surgery. They know what to expect, and their families and coaches, we welcome them to the program. And then also during their surgical stay, they also know what is going on. We have several great highlights of the program, such as we try to get patients up the very same day after surgery, and then we try to guide them through with a personalized collaborative approach through the program. And then after discharge, it's my great joy to see how they recover and get to their goal of recovery.
Yeah, it's just amazing. Because, you know, before when you'd have surgery, you know, maybe 10, 15 years ago, you'd be like, okay, no, you would rest for a few days and then they get back. Now it's like they just throw you up and you stand up and you're ready to go. It's actually quite remarkable. Is that because of the thought process that goes into this, or is it the surgery that's maybe changed?
It is definitely the approach. With the whole multidisciplinary team, the approach these days is to get you up and get you going as soon as possible. We know that this is going to lead to the best recovery.
Okay.
And that's why we are working together as a multidisciplinary team with our orthopedic surgeons, with our bedside nurses, and with our therapists, occupational and physical therapists, to lead you to the goal. We know it's a team effort.
Yeah.
It's a team, and the early mobilization is definitely a very important part of it.
So where is it located within the hospital?
So the Spine Surgical Center, Health Center is, it is really, before surgery, it is me contacting and calling you. At this point, we have virtual classes, which is on a way beneficial to our patients because they have been mastered by now the virtual world. Right. Because of the pandemic,
sure.
And they really appreciate not need to come in an extra time.
Absolutely.
So it starts with that, and then it continues when you come into the hospital. We have dedicated nurses, dedicated therapists, and dedicated unit for the surgical patients.
Okay.
We also have, believe it or not, a rehabilitation gym.
Great.
So our physical therapists and occupational therapists take the patients to a gym to practice all the skills what they need for successful recovery.
Okay. All right. And is that where they would go afterwards as well to do therapy?
Some of our patients, pending on their insurance arrangements, we are welcoming them to our rehabilitation center, outpatient rehabilitation in the Saddleback. We certainly are more than happy to have these patients and continue their recovery with us.
Okay, fantastic. And of course, you know, when you have surgery, many people are prescribed pain medication. And often doctors are a little concerned about that, right? Because sometimes you don't take it, or sometimes you take too much. So you guys have, you know, pain management specialists too.
Well, we have a multimodal approach to pain management, which means that our orthopedic surgeons and yes, there is pain specialist doctors if the surgeons feel it is the right way for pain management. We have those in-house, but the multimodal pain management approach means that our surgeons try to minimize narcotics involving other medicine and, for example, cold therapy that we like to use for our patients to minimize the use of a narcotic medication.
Right.
Because we know, again, it's a multidisciplinary, multimodal approach, the less narcotic medication we are able to provide the same pain relief, the less side effects we have, and better is the outcome.
Have you incorporated any holistic approaches?
That is something that we definitely thinking about it. It is going to be the future. We do our nurses like to utilize music therapy if it's possible. And then also we, with the cold, our physical therapists are utilizing the cold therapy, I would say, to minimize the pain. And just being there and guiding patients sometimes helps with reducing of an anxiety and depression. And those signs all contribute to reduced pain sensations. But more alternative or holistic therapies will be on the horizon how we proceed.
That's excellent. Well, thank you so much for all the information and for everything that you're doing. That's a lot.
Thank you so much for having me. I'm really excited, and I hope to meet a lot of Laguna Woods residents who need this kind of an intervention.
Thank you. If you want more information about anything that we have discussed, you can always go to memorialcare.org/SB Spine. We'll be right back. You did great.